Hi guys, I'm Shahira and I'm a general dentist.
And I'm Adam, and I am almost a doctor. And today we're going to be talking about doctor versus doctor, the four biggest differences between medical school and dental school. So dental school versus medical school, obviously they're both 4 years, but they're very different. Why don't you tell us about dental school first?
A common question I get is how long dental school is. Dental school is actually 4 years just like medical school. So that's kind of important to know. You're not saving time per se. So the first years in dental school, you're in lab. So that means practicing on fake teeth, drilling, filling, waxing, everything in lab for the first 2 years, simultaneously while taking all of your core classes. So it can be very time consuming. The last 2 years, you are in clinic. You are your own clinician. So you're seeing your own patient pool and you're responsible for all of their needs for the last 2 years.
So that sounds really cool, and that's really different than medical school. The first 2 years are similar, and I've actually heard at some medical schools that the med students take the classes with the dentists. They're all together for some of their basic classes.
Yeah, and even if they're not together, we'll have the same lecturers, the same slides.
Yeah, so it's very similar those first 2 years. You're getting your basic content done, but then from there, you're doing anatomy lab, you're doing, if you're a DO, you have OMM lab, you have like procedure labs, like sutures, casting and splinting, all of that stuff. And then you finish your second year, you take your boards, and you go out on rotations. Now, it sounds like it's really different. Rotations, we're supervised the whole time. So we have an attending, sometimes there's a fellow, sometimes there's usually residents, multiple years of residents. So we're way down the line. We're doing like the bottom end work.
You guys have to sort of climb that ladder, whereas in dental school, when you graduate, you're done, you're a dentist, so
right, and
you're really responsible for your patients on your own.
That's very different. So as a med student, you definitely take some responsibility. It gets more your fourth year, they kind of treat you more like an intern, but you're still under supervision.
So let's talk about the timeline of dental school and medical school and also specialization. In dental school, it's 4 years and you do not have to specialize at all. So that means after you pass your boards and you take your licensure exam, you're a dentist, you can work in private practice. Now, if you want to specialize, it's an option. So in dental school, there's many different specialties if you want to have a different focus. So there's endodontics for root canals, ortho for braces, perio for gum, oral surgery. So those are all elective and they range from 2 years all the way to 6 years.
Wow. So medicine's different. You can't really practice just from graduating med school. So in just a few months, I'll be doctor, but it doesn't really mean it. I can't do anything with that. You still need a residency in the United States. Now, I think there are some exceptions, and some comment warrior is going to put it down below probably, but for the most part, you cannot practice without that residency. Residencies start at 3 years and only go up from there. They can be as long as 7 years or more depending on what you're doing. There's specialty programs, special surgery combined programs, so it can be even longer. You're not going to be practicing for a minimum of 4, 5, 6, 7 years probably, maybe even longer after you started med school.
So thinking about the timeline is really important when deciding between medical school and dental school and being realistic with how long you want to be in school and sort of like where you are in your life and how you want to go about that.
Very true. Owning your own business, is that even a thing in medical school? I know we talked, it might be in dental school, it's a lot more popular. Why don't you tell me a little bit about that?
Sure. So that was actually one of the main reasons why I chose dental school over medical school is dentistry allows you to have the option to be very entrepreneurial. So you can have your own private practice. It's not something you have to do, but it's definitely an option that's very feasible. And with that comes, less headache with insurance companies, more fee for service, and a lot of things in dentistry can be totally elective. So basically, if running a business or owning your own practice is something that interests you, then maybe consider dentistry as an option.
Now, I think it's totally different in medicine. Owning your own business used to be a super common thing to do in medicine. You'd go out, you'd open a practice, and that would be it. You'd practice family medicine, internal, whatever it was. Now, being hopefully in emergency medicine next year, it's a lot different. Used to be that you could work for a hospital or a physician group. Now there's these big kind of physician conglomerate groups that seem to own everything, and that's kind of spreading into most of healthcare. There's very few physicians who still have a private practice. I'm not saying it doesn't exist, but to be a single physician owning a practice is just not common. You will see physician groups, so 5, 10 physicians that own a place, share a surgery center, something like that. But you're not going to see very often just one doctor.
It's just not as feasible. And don't get me wrong, they're coming for dentistry too. But not for a generation or two we have of owning our own private practice
Sure.
before corporations take over.
So there's one big difference. If you want to own your own business, you don't want to work for someone else, maybe it's better to look at dentistry, especially if you enjoy working in the mouth and working with teeth.
So this is the ultimate question I get all the time. Doctor versus doctor. What is the real difference between a dentist versus a doctor? And is a dentist a doctor?
That is a great question. So I would say absolutely. Dentists are definitely doctors. Doctors are doctors. The way I look at it is a doctor, a DO, or an MD is a physician.
Sure.
They're able to treat the whole body from head to toe, including the head, neck, mouth. So if you have a dental abscess, I can treat that. It's not my area of expertise necessarily. I'm not going to do a root canal, obviously. That's way out of the scope of my practice. But if I need to do a dental block or
Yeah, if
aspirate
Adam
something...
has a pneumonia, I'm not going to be treating that.
Exactly. So you guys, I would say, focus head and neck up this area.
Yeah.
And then physicians, like I said, can be almost anywhere in the body. Now, I think the one thing that kind of transcends that boundary is oral surgery and the MD, DDS, or DMD programs, because they kind of round in the hospital. I've actually rounded on the floors with DMDs that are doing their rotations, and they're like on internal med. So I think that kind of separates the border.
So oral surgeons, there's 6. So oral surgery programs, there's 2 types. One in which they get an MD, so they're essentially a physician and a dentist, and ones where they do not get an MD. The no MD programs are 4 years, and the MD programs are 6 years. So that would sort of transcend the bridge between dentistry and medicine.
So there you go. Both doctors, a little bit different, but maybe there's options to cross over too.
Yeah.
Another thing that I think people always want to know is, can you write pain meds? Can you write antibiotics? Obviously, you go to your doctor, you get antibiotics. Everyone that has a freaking cough for one day wants an antibiotic. Can you do the same thing?
Of course. So yes, we deal with infections and painful procedures, as I'm sure you guys all assume. So we can definitely prescribe antibiotics and pain medications. Of course, we want it to be in our scope. So if you have a UTI, I could technically give you an antibiotic, but I'm really not your go-to for that.
Right. I agree, and I think that makes sense. Like we talked about head and neck and up, the urinary tract system is not in that area.
Yeah.
And so maybe you could look up the antibiotic, but that might not be something you prescribe often and probably a little bit out of the scope of practice.
Exactly.
So we both prescribe, just focusing on our specific areas.
So drop a comment down below, guys. I want to know, do you think dentists are real doctors? You know who to support.
Thank you everyone for watching today's video. Before you go anywhere, do me a favor and give us a thumbs up. That lets us know that you enjoyed today's video. Also, smash that subscribe button, turn on the notification bell so you don't miss a single video that we're putting out. And before you leave, if you enjoyed, head on over to seethemedlife.com. We've got lots of awesome stuff, from the merch all the way to the blog and everything in between. Check it out, and we'll see you in the next video.
Hi guys, I'm Shahira and I'm a general dentist.
And I made a weird face, so I'm sorry. We're gonna start it again. So...
I was so not ready.
You're like...
There's a lot more procedures that are elective, so what am I going with this?
I don't know. I'm not in your head. You're snapping away.
Do you think dentists are real doctors? I know who to... Okay.
That was good though.
That was
Okay,
good,
okay.
yeah. Good
I know,
energy.
I support myself.
I love myself.